I am Dr. Vikas Gupta. I am a consultant surgical oncologist or cancer surgeon attached to MGM Hospital CBD. Today we are going to discuss something about breast cancer. Breast cancer is one of the most common cancers which affects females in India, and the number of patients who are affected with breast cancer has been increasing gradually. So, as you know, breast cancer is much more common in females, and we always hear about females, but it is also seen in some males. There are many causes of breast cancers. Few of them are modifiable and few of them are non-modifiable. Amongst the non-modifiable causes of breast cancer are, the most common is the age. So as the age increases, the number of patients who get breast cancer also increases. It is more common in the post-menopausal age group. Other factors include female sex. It is obviously more common in females. Besides that, certain patients are genetically predisposed to develop breast cancer. Around 5 to 10% of patients of breast cancer have hereditary predisposition, because of which they have some genetic markers, the most common amongst which is BRCA marker. In these patients are more predisposed to develop breast cancer or ovarian cancer. The other factors which are non-modifiable and which contribute to breast cancer are early menarche, that is early age of starting of the menstrual cycle, or late menopause. This is because it increases the number of cycles that a lady has in her reproductive age group, and this increases the risk of breast cancer. The other factors which are modifiable which contribute to breast cancer are obesity, lifestyle-related changes. Obese females are more prone to develop breast cancer. Besides that, alcohol consumption has also been related to developing of breast cancer. Nulliparous females, that is females who do not give birth to child in their reproductive age group, are more predisposed to develop breast cancer. Besides that, lady who does not feed her child with breast milk is also more predisposed to develop breast cancer. The diagnosis of breast cancer is based upon a biopsy test in which we remove a small tissue from the lump in our breast and send it for investigation, which proves regarding the presence of cancer. The other tests which are usually done include an ultrasound of the breast, which is done in the younger age group. Besides that, a mammogram, which is a very special X-ray which is done for CA breast diagnosis, is also a very important modality. We also recommend screening for breast cancer with a mammogram test, which can be done once every 2 years, starting from 50 years of age group and going on till 75 years of age group. Once we have done mammogram and biopsy and have confirmed the presence of cancer in the breast tissue, we further do special tests as required in different patients, such as PET scan, which is a scan of the entire body to look after disease spread in other parts of the body and to confirm the stage of cancer. Once we have confirmed the stage of cancer, we explain the patient regarding its treatment. The treatment essentially involves 3 important things: surgery, chemotherapy and radiation therapy. In surgery for breast cancer, we remove a part of the lump itself, which is called as breast conservation surgery, or we remove the entire breast tissue on that side, which is called as a mastectomy. Depending on the size and location of the lump, the doctor may choose either one of these 2 options and counsel the lady regarding the same. Once we have done surgery for the patient, depending upon the report which comes, depending on the stage of the disease, we counsel the patient for further therapy. Further therapy for this patient is involved mostly in the form of chemotherapy, which is given over a period of 4 to 6 months, depending upon the type of the tumor which we get. There are different chemotherapy options available nowadays, and what is best suited for the patient is given to the patient after surgery. Sometimes we also give chemotherapy before the surgery to decrease the size of tumor and then plan for surgery. The third option is radiation, which is part of the treatment, and some patients may also require radiation therapy at the end of surgery and chemotherapy. So this in brief tells us about the breast cancer, its causes, how do we diagnose it, and what are the treatment modalities available for breast cancer. One important thing is, once you have breast cancer, it is not end of the world. If diagnosed early in the stage of the disease, it is definitely curable. So do consult your surgeon if you have any kind of lump in your breast. Thank you.